So we received several questions. May I have a choice privilege and start with one? Okay. So, Gary and Gino, why do you think there are so many differences on ketogenic outcome?
I think we pretty much show the same benefit because pure ketogenic diet show improve the memories, right, learning memories, and we show the same thing with MCT diet. But the only difference, we achieve the ketone with different angle.
Okay.
One is we use pure ketogenic, one we use MCT as a precursor. So I think pretty much all two consistent to show even two species different have same benefit.
I think another, Mike, you're a pharmacologist, so he's showing benefits at 100 micromolar BHB. We were showing our benefit in the in vivo studies at more like a millimolar BHB, but when you took it to in vitro, the sensitivity was 100 micromolar, just the same as his.
Excellent.
So I think it's the same mechanism. We wanted to be aggressive, I would say, in trying to get the highest BHB level possible for a pharmacological effect and an in vivo effect. But I think his data and our data together with the in vitro are showing that the dose, the effective dose might be lower. Yeah.
Okay. So, any questions or comments on the ketogenic from the audience? Ketogenic topic? Okay.
Can I ask a question? Back in the back.
Please.
There was reference to keto drugs, but I don't think most veterinarians would be familiar with that. Are there any keto drugs that you can name, and have any of them been assessed for safety in dogs?
So we published on the first keto drug. It's idebenone. It's not its recognized function. But we've published on that, and it induces these same benefits. So I'd be delighted for somebody to test that in some dog indication. I don't know if idebenone's been used in animals, in dogs and cats. But anyway, that's one. And then we have new molecules that have never been in human or animals. And so those are the keto drugs, yeah. And those are, they belong to the company, yeah.
Okay. Satisfied? So I'll take a question via the chat. This is for you. Dr. Creamy, what is the reason for increase of P16 with increased aging?
So we would be using P16 as a marker of senescence, and so that would be indicating that you have an increase in senescent cells if you have an increase in P16. I'm not sure if the question was meant to be more complex than that. It's
no,
it's
this
just a
was
marker.
Actually just a line.
Yeah, it's just a marker for senescence. So by showing that its usage in this case, you're just documenting that you think you're identifying senescent cells in those tissues.
There are other questions. So I pick one which is about, do we know why the feline do develop so severely this CKD compared to other models?
No, I think that kind of goes to the root of the questions about the etiology of kidney disease. So right now the theory is that we have multiple damage events throughout the life of the cat, and so when you combine that with the concept of aging, that's probably why chronic kidney disease is so common in the elderly patient. So I think it's multiple factors together, and whatever those injury events are, they probably are, it's multifactorial. There's not just, we've never shown one, infectious disease or something like that is specifically the cause of kidney disease or exposure to something, but it can be a variety of different exposures or injuries that would culminate in clinical disease. And you probably, especially in the aged kidney, since it's less likely to repair itself normally, that aged kidney is going to be more susceptible to those insults.
Yeah, and this is my question, so if it's okay. So you discussed very briefly about the use of senolytic drugs, also advertising for the severe side effects. Can you please elaborate on that? Because I reviewed so many grounds on senolytic drugs used in cancer, so...
Yep. I don't think we know the answer, and I don't know if your question is specific to cats or not. We certainly don't know anything about those drugs at this point in time. But I think the concern, at least my concern from the standpoint of the clinician looking at the pet, is it safe to use these medications? The concern would be if you're actually taking out senescent cells, can you in fact take out too many and affect overall function? Like, we don't have a good idea of what the effect would be if you're actually removing those cells from the population. So in my mind, ideally, it might be better to intercede earlier when you're just having a small number of senescent cells and you're just very gently taking them out, as opposed to what if you interceded later and you were actually removing a large population of senescent cells? I don't actually know what the result on kidney function would be. Like, what are those cells doing? They're senescent, but how functional are they otherwise? So I think there's a broad spectrum, and again, that's why I mentioned timing as being quite key. That's probably pretty important. So that's a big hurdle, I think, for the senolytics, is not really knowing how much is too much or when to intercede in that course of disease.
So you made also a good point about this, let's say, natural evolution of the kidney cells, and then all of a sudden they are exposed to a chemotoxic stress given by medicine, and then cause the severity of the disease?
So, I mean, we do unfortunately have nephrotoxic medications, right, accidentally. I mean, there are side effects. So I just use that as an example of something that might happen. But, I mean, any clinician will know what might exacerbate kidney disease. It could be, and there may be ischemic events that are happening on the kidney level that we're not even aware of. Cats tend to be very dehydrated in general. We don't know the effect of that, but probably a good example, and why I get concerned about hydration, is Mesoamerican nephropathy, where you have a condition where basically field workers in really hot climates that don't have the capacity to drink a lot of hot water and work in really, really arid environments and work for long periods of time, they actually are documented to have multiple AKI events over and over again, and they develop a form of kidney disease that's probably actually very similar to cats. Again, from those repeated injury events is the theory at this point in time. So then you add on the accidental medication that might further harm that kidney, or an anesthetic event where the animal is hypotensive, and you're setting yourself up for a potential crisis with the kidney. So there's just I think things to think about clinically that we have to take into consideration, and I'm always that much more careful with that elderly patient, knowing that their kidneys might actually just be on the brink of having a problem, and trying to be as cautious with them as possible.
Thank you.
Yeah.
Please.
Jessica, you said that when you see clinical symptoms of disease, it's already too late, and we basically don't know when it starts. So if you really have like early markers, and we know that, do we know what to do then?
Right, it's a great question. So when we talk about the diagnosis of early kidney disease, we're probably still talking about clinical kidney disease. And in stage 1, you might have lost, urine concentrating ability in the cat or something like that, or you have evidence of changes in the kidney on imaging. But I think the question is also this concept of aging. Should we actually be worried about the aged kidney even before you get clinical pathologic abnormalities? We don't know anything about how to support normal or aged kidney health as opposed to early chronic kidney disease, and we're still learning a lot about how to support, nutritionally, medication-wise, et cetera, the early stage chronic kidney disease cat. But I would back it up even further, because you're right. Again, once we get to that point, we already have some degree of disease. And I do think we also need to think about that aged kidney component and how you could actually be supporting the health of the aged kidney even before we get to clinical disease.
Thank you. I think, Nicole, you have a point? That was a nice question.
You read my mind.
No, please.
I was actually just going to comment and support your thought there, because I think for any tissue, we really don't have a good definition of what is normal aging.
Right.
And what is preclinical disease. And for many diseases, we know there are phenotypical changes in those cells and metabolic changes in the cells of different tissues that precede the onset of any clinical sign. So the question then is, again, with that kind of geroscience hypothesis, if we're going to impact that, we need to think about it way upstream of the disease presentation, and how far upstream do we go to intercede that would be the most effective. And I think that's kind of the question of the century, right?
Right, absolutely. And I think that's where I think my idea of the quest for biomarkers of senescence that would be clinically useful would be, can we actually identify that process even before we get to clinical disease? To your point, and is there then an intervention that we would do early before we even get to the point of clinical disease? So that's another huge open area that I think needs to be looked at.
Excellent. Anyone from the audience about the fast aging kidney in cats? So I'll get back with a few points, but Gino, there is a question for you.
Okay.
About does the type of fat within the keto diet have an effect? I guess saturate versus monosaturates.
Doesn't seem to. So this was done with basically pork fat as part of the feed, and I know, and he's published it. Dr. Ramsey did an earlier study where he looked at adding unsaturated fatty acids and did not see a longevity effect. Yep.
Okay. So there are other questions. One is for me. Am I allowed to read it?
Yes. Yeah. You want me to read it?
Yeah. So, been asked several questions. So, one of these is about how the accumulations of cholesterol, the unmetabolized cholesterol, has an impact of the transcription of gene. So, this is hard to detail, but we believe, the data we have is that the accumulations of cholesterol on the membrane of the nucleus generates a sort of stiffness that's trapping inside the transcription factor. And so, therefore, it has a pro-oncogenic role when it's accumulated and not metabolized. So, and the other questions that have been asked was about, is a question that maybe we can, the four of us, answer together. So, can we describe the good and bad effect of MCTs on mitochondria?
I think Gary.
Please, Gary.
Gary kind of talked about that.
And we follow up.
MCT on mitochondria health. I think
Closer to microphone, please.
Okay, sorry. So based on, if you look at literature, based on literature, the MCT actually convert to the ketones. Ketone actually, BHB actually can enhance mitochondria energy metabolism, and also can reduce mitochondria RS production. It seems the ketone from the MCT become cleaner energy for the whole body. If you reduce RS, that's good for the whole body and slow down the aging process. And also MCT, the ketone actually become is anti-inflammatory and antioxidant in the cell. So I think not only for the energies, but also have other benefit beyond energy supply. I think this is an emerging area when you think about how do we sustain the ketone in our body around the clock without disruption. Like we maintain our glucose in the blood without get the hypoglycemia. We don't want to get the hypoketonemia, whatever we can come up with the words. I think that's my take. We need to maintain our ketone at a certain level around the clock, having the benefit.
Do you agree, Gino? Yeah, please.
Just to follow up on what he said, I can't prove, we haven't done the in vitro studies yet with mitochondrial, with BHB and then looking at mitochondrial biogenesis, but we do see that both in the liver on the ketogenic diet, we see an increase in mitochondrial enzyme activity, presumably because you're activating this pathway, and then we see it in the hippocampus, where we see, I didn't show that slide, but we see mitochondrial biogenesis of complex 1, complex 2, et cetera. Why? Likely because you need more mitochondria if you're oxidizing these fatty acids, right? It's just substrate. They're less oxidized because than glucose or BHB. So you need more to get the same energy produced. Yeah.
Yeah, I mean, the question comment was about the negative effect. I mean, correct me if I'm wrong. There is some literature about the starting cholesterol level that may affect some of the MCT-driven activity. I don't know if you have seen the same, because I mean, biochemically, the MCT seems just to be a good thing, but then.
So yeah, so in our study, when we use CAC10, we didn't see increased cholesterol in dogs. I think if we increase cholesterol, more likely relate to the C12, because C12 increase triglycerides, or this will increase the cholesterol level. I think more likely C12 side effect, but the CAC10 is pure ketogenic based on our research.
Excellent, thank you. I hope whoever wrote the questions is satisfied. So then another question for me, then we got other for you. Obviously from the audience, feel free to, oh please. Gray.
Yeah, thank you. Rita Dobenecker from Munich, and I have a question for you, Dr. Kwame. And this is, what do you think is the reason we are seeing an increasing number or increasing prevalence of CKD in cats?
I mean, that's a great question. I think, honestly, part of it would be that they're living longer. I mean, I don't know what the evidence is in terms of the actual improvement in lifespan for cats, but I certainly feel like my clinical impression would be I see a significant number of older cats that are getting better care, and there may be an aspect of actually identification of disease that confounds. My question would be, is it truly an increased incidence, or are we more aware in some instances, and we're seeing it more and we're identifying more? So I think that's part of it. I wonder myself about that question. But then the other part of the question would be, if we are truly seeing such an increased incident, is there an environmental reason for it? I don't know the answer to that. I don't know that we would have an explanation for that, why that would be a case. But I do worry that impression is confounded by the care that have, when I think about how cats were cared for when I first became a cat owner at the age of 0, and how those cats live their lives compared to how a lot of cats live their lives now, there's a drastic difference, and the time that I've been a veterinarian as well. So I do think that question has two sides to it. I'd also love to hear thoughts as well, if there was something you were thinking in particular. I would also question from the standpoint of a dietary perspective, and knowing your area of interest, is there an aspect of calcium phosphorus metabolism that is driving some of this? Do we have more stone disease than we did before that is actually serving as a nidus of inflammation? And that I don't know the answer to either, but it is a concern, I think.
So, I mean, your data have been carefully scrutinized. So someone is asking, can you explain why there is a lipid accumulation in feline kidneys?
Yes. Why do cats accumulate lipid in their tubules? We have absolutely no idea. And it's actually not just a domestic cat phenomenon. It happens in large cat species as well. So there's some really, and it's also not a new phenomenon. So that some of the original research on that goes back very, very far, like early in the, well, last century. So, and I don't know why there's a species specificity to that, but it does seem to be, at least the degree of lipid accumulation seems to be specific to cats. So I think that lipid metabolism is definitely something that would be important to study in conjunction with kidney disease as well, because that would be another, why is that happening, and can we put a halt to that? So it is unknown as far as I know. Yeah,
I couldn't agree more. That needs to be studied. So then I have a few more questions for me, and I'll just pick one because I guess we have time constraints. And is about which are the nutritional options you foreseen to try and potentially tackle these progressive alterations in the signaling due to cholesterol. But then another question is about what using EPA and DHA, can it help from omega-3? My guess is it could be of some help to try and keep the redistributions of cholesterol abide or pushing its metabolism. But I guess this is a question we all have to answer together in the year to come. So if my schedule is correct, I think our time is up, and I really thank you for your excellent informative talks. I also would like to thank Anna, who could not join the panel, even though she was tuned in for a last-minute issue, but she will be happy to answer any questions via the digital channels. Thank you again for your talk and for these interactive conversations. Thank you all.